Hi, my name is Tobias Stanelle, Managing Director for Ascom Americas. Thanks for joining us today for our Ask the Experts conversation on virtual nursing. I'm joined today with Adam from AvaSure. Adam, would you like to introduce yourself and your company?
Absolutely. Tobias, thanks for having me here. It's a real pleasure being in your cool demo center. I'm Adam McMullin, and I have the privilege of leading AvaSure. AvaSure is the largest provider of virtual care and computer vision solutions serving over 1,200 hospitals across the U.S. and Canada.
Great. Thanks for being here and excited about this conversation. Look forward to just getting your thoughts on the space. I thought we'd start with virtual care, generally speaking. Maybe get your thoughts on the types of problems customers are looking to solve by bracing these models.
Yeah, absolutely. I think there's been a continual drive for health systems to try and make sure that they can address sort of the workforce constraints that they have, whether that's constraints in nursing or physicians. And that workforce productivity problem is right in the forefront of the things we're trying to help health systems solve. In addition, and really exacerbated potentially this year, there's still a lot of uncertainty around Medicaid and Medicare reimbursement and 340B. There's just a higher focus on the financial performance. And the third thing is this continual drive towards improving outcomes, that journey that health systems has always been on. So as we engage with customers, we want to make sure in a very demonstrable way we have that financial, sort of that workforce productivity and that safety value proposition delivered in everything we're doing.
Absolutely. Yeah. I want to come back to this idea of outcomes. So for providers who are making these investments, embracing this technology, what type of impact are they trying to have? What are the measurable outcomes they're going after?
Absolutely. So when we work across, so we have the privilege of serving about 1,200 hospitals. So we see a lot across the US and Canada. And some of the outcomes we're seeing are on the virtual safety side. Every time you're managing safety, falls, behavioral health issues virtually, you're saving around $20 an hour. So for University of California, San Diego, they save $2.5 million a year. For University of Colorado Health, they delivered 600,000 hours of safety observation. That was over $8 million of savings. So that's on the safety side. When you get into virtual care, we recently Hackensack Meridian Healthcare did a study around virtual nursing, and they cut their agency spend down by over 2/3.
Wow.
They reduced nursing overtime by 25%, and they reduced their length of stay by 12%. So those are the types of outcomes that allow you to do more with less, allow your caregivers to practice more top of license, and then dramatically make a difference in outcomes. And just maybe highlighting outcomes for a moment, Ochsner reduced their patient falls by 50%. And we often see those kinds of metrics when you're bringing in virtual elements and complementing your in-person care team. In fact, over time, I think we'll get out of that sort of concept of virtual, and it's just how care is delivered, right? It's really fused between what are the things that have to be done in a room and by a bed with and how they're supported with virtual care centers or virtual engagement from professionals wherever they're located.
Yeah, no, those are some powerful examples. Adam, I want to turn our attention to virtual nursing specifically. For a provider looking to start a virtual nursing program, what are some of the key considerations you'd encourage them to think about?
Absolutely. Number one, you're going to want a scalable, reliable, proven platform. We've all seen failed technology implementations, and nothing destroys trust with a clinical team like a failed implementation. And then it's not just the technology, it's the change management. And that change management where you want nurses working with nurses against proven outcomes and protocols to get to the right results. And then the third thing is nurses don't want to be an integration layer yet again, right? To really create a more seamless, integrated environment. And that's some of the things we're really excited about working with Ascom. I know some of the discussions we've had with your team, you guys have talked about sort of a spectrum of ways that customers can get started quickly and then continue to evolve that as time goes on.
Yeah, I think the technology adoption is definitely a journey. We do look at it as a continuum. I think at a basic level, you talk about alarming within a room. First experiments or investments in virtual nursing might be co-location and routing of alarms to a central location, but then ultimately really trying to leverage technology to drive the full clinical context, integration into nurse call, integration into clinical workflow with nurses and handsets, and really making that as seamless as possible to drive timely and quality response.
Yeah, nurses are visual and they're working, in the moment on those units, and to be able to look down the hall and understand where a patient's being monitored for risks, where are virtual engagements happening in those rooms, if there is a critical alarm, such as someone's a falls risk, lighting up the dome lights and integrating with nurse call so they can take advantage of the investments they've already made, just makes for a safer, more resilient environment.
Yeah, and I think that's a lot of where the excitement is coming from for this partnership from Ascom as well. Everything that we see is really geared around increasing patient context around interaction, and then really driving that integration into clinical workflow to get better decisions faster and ultimately drive better patient outcomes.
Yeah, we love these types of collaborations because too often there's been, in healthcare, it's been kind of hard to get the technologies well integrated.
Yeah.
So, we're an open platform and we really seek relationships like this to make sure for the benefit of our customers that you can reduce work steps, you can increase reliability, and, create that more integrated smart hospital type environment.
Definitely. It's exciting space, changing rapidly. If
Oh
you
my
were
gosh,
to
yes.
put on, I don't know, the crystal ball for a second and think about where this is going, future trends, how do you see virtual care, maybe specifically virtual nursing, evolving?
Absolutely. I think we're at the very early stages still of broader adoption of virtual care. And, there's this is an example of an AvaSure mobile device here in the background. That's a great way to get started with virtual care. Increasingly, those devices are getting put in every room. And as you do that, you can start layering in more and more use cases, from doing admissions and discharges to remove documentation burden, but also have more thoughtful admission and discharges processes, and, integrating family members. Uh, physician rounding and engagements, you'll see more of that. And then once you put these devices in every room and you have high quality audio and video from the rooms, you can start adding a lot more. Particularly, we're spending a lot of time in computer vision, and we can predict if a patient's about to get out of bed and be a falls risk. Did they get fed, from a nutrition perspective? Did the room get cleaned? So you're going to see a lot more automation happening that happens as a byproduct of putting these devices in every room. And then you can make that data very actionable to further improve workforce productivity and safety. So it's a pretty exciting space.
Exciting future, and yeah, looking forward to being a part of it with you.
Great. Well, hey, thanks for having me.
Thanks for being here.